excited to bring to you guys a friend of mine who I was introduced through a couple other friends. We'll explain it in a second. And she actually went through triple negative breast cancer and has been on the show 6 times now. And I don't want to have the wrong name on the screen. So, Courtney, you're going to wait just a second so I have the right name on the screen. My assistant producer had to bow out last minute today. She's going to school and has a report that she wasn't able to finish in time. So I said, don't worry, dude. School's more important. I got you. And so now I'm going to bring Courtney with the right name on the screen. It's the broadcast. Welcome to the show, Courtney. What is up?
Hello, April. How are you?
I'm awesome. How are you, man? It's so good to see you.
It's so good to see you too.
Awesome. I was telling you on the break, I was like, we're like running ahead of schedule, but I jabberjawed just enough that we're only 4 minutes ahead of schedule, so we're doing pretty rock and roll right now.
Oh, cool. Well, then you're right on time.
Exactly. Yeah, exactly. So Courtney and I met through a couple of people actually back in the day. It was probably 2016, 2015 when we met, I guess.
Yeah, 2015 probably, like around the end of 2015, I believe.
Yeah, and you actually had been in the same business as Brandy McComb, who's a volunteer, and she does a lot of photography for Breast Cancer Can Stick It. But before that, Brandy and I have been friends since about 1996 ish. And
Yeah.
she told me about you when you were diagnosed with triple negative breast cancer because,
hmm
as we know, it's not that easy often to find other triple negative breast cancer survivors. When you're first diagnosed, you're kind of scrambling to find other people who have been in the same situation. So I was glad
Yeah.
that we were introduced, and then also come to find you're the cousin of Jeff Durbin,
Yes.
who is who is I was in a band with called Slow Gin, and before that we were called Freeloader. But
Yep.
and that was back in like the early '90s that Jeff and I were in a band together. So he mentioned your name to me as well when you were
Yeah.
diagnosed. So you came to me from many angles, and I'm so glad
It was
you're
meant to be.
yeah, you're in my life and doing, makeup for my wedding for me
Oh, yes.
and just amazing with your business. And I'm going to give you a second before we get going to go ahead and plug your business and let everybody know
Oh,
what it is you do,
yeah.
man. Girl, give it up. Tell us.
Absolutely. Like I own Cairo Makeup and Hair, and my background is kind of in production, but I do weddings. I used to work for Sony Pictures back in the day, back out in LA. But yeah, so Cairo Makeup and Hair, CairoWeddings.com. We do all kinds of weddings, small, big, COVID, whatever. We got it all.
You got it all. And Cairo, that is Chiro makeup, right?
Yes.
Cairo makeup.
Cairo. Cairo is the first letters of Christ in Greek. So we are a Christian-based company, and yeah. So we love everyone.
I can attest to that because she loves me somehow. You're awesome,
And
dude.
we had the best time doing your wedding. What a fun wedding! I mean,
Oh, thank you.
it felt more like a rock concert
It
to
was
me.
it was like a rock concert, man. It was so fun, and I
It
was so
was so
happy
much
that you were
fun.
there to make us look pretty, man. It's so cool. So
Yes.
so girl, man, you and I were talking yesterday, and I was like, wow, 2016 was the first time you were on the triple negative breast cancer broadcast, and you were
Yes.
just completely bald,
I
completely
was. I
bald.
remember that show very vividly because I was so sick. I think I want to say maybe I had just started the Red Devil when I did that show, and I was like pushing man hard. But I was like that when I was going through chemo. I don't know what it is, but you get so connected with God when you're going through something like that you just get this supernatural strength and you can kind of just do anything. At least for me, it was that way. And it was just like, it really wasn't me anymore. It was like him carrying me through it all. So, I can remember that very vividly. And I remember saying, okay, if I'm going to be bald, I'm going to always have bold lips on. And so I always made sure I had bold lipstick on and big earrings and like,
You
try
were,
to.
yeah, you totally dressed it up, and you made it look so beautiful. I mean, you really
Man,
did.
well, thank you. I really appreciate that because I mean, a lot of people were like, "Oh, it's just hair," but I'm going to tell you what, I mean, a lot of us women, I mean, we really hold on to our hair, and it's kind of a comfort thing for us. And so, having to shave it off, it definitely was hard for me. Of course, I would do it again, to be alive, a million times over. But it still, I mean, you still struggle with that. It's like people don't, you don't understand it until you actually go through it. But it really, it can really affect you, and some people more than others. But I try to stay really positive, and try to tell myself it's just hair, and it did grow back, as you can see.
I
I'm
know,
six
your
years
hair is
old.
so long. Oh my gosh, it's
It's
so
very long.
long.
I can't believe how long it's gotten, and I never straightened it because, I mean, I was a curly girl before chemo, but then after chemo, I'm so sorry, my dog's barking, but after chemo, it got like even curlier, and so I got that chemo curl, and so it was just super super tight. And now I straightened it last couple of days or 2 days ago, and it looks so long. I'm like,
It's
it's crazy.
It is. It's so crazy. You're talking about that when when you're bald that you made sure that you wore bold lipstick and you always did your
Hmm.
makeup up and you had the big earrings and everything. I had this weird thought that I've never asked you. So okay, so when you put it on makeup,
Yeah.
and like you have like kind of a perimeter, right? It's sort of it's kind of
Yeah.
like your chin all the way up to the top of your forehead. You've got this kind of canvas, so what
Yeah.
do you do? Like, how do you blend? Because you're not going to put makeup on your whole noggin,
Yeah, I mean,
right? So how do you do
that's
that?
totally a great, like question to ask. I mean, I would kind of blend it up into where my hairline would have been. So, and I would try to match more so with what my scalp color was than actually my face, because our face, when you first shave your head, you're going to be lighter underneath than you are on your face. And so, because obviously, that hasn't seen the sun as much. And so, yeah, I mean, definitely, I just try to match the makeup to my scalp. And also, thing that's a really good point to make is, I used to use a lot of coconut oil on my scalp, and that helped a lot with the growth as it started regrowing. And I also would do an exfoliant on my scalp, because a lot of people don't realize that your scalp does need exfoliation for growth. And so I would use like a sea salt exfoliating shampoo the whole time I was going through chemo, even though it wasn't growing, but that'll help exfoliate so you don't get clogged hair follicles. And it also helps once your hair does start growing for it to kind of kick up and start growing a little bit faster. So that's a little tip for you ladies out there that are going through
No, that's
chemo.
fantastic. I mean, because I know we have a lot of ladies watching, especially from the triple negative breast cancer survivor group out there that has
Yeah.
7,400 members. So thankful to have met that group and gotten to know so many people there.
Yes.
But providing that kind of information is great. I mean, you're a professional and an expert in this field when it comes to hair and makeup. So knowing
Yeah.
what to do with that is
Yeah,
super
and
important.
like, yeah, but I mean, here's the thing: is I'm an expert in pre-chemo. I learned so much, as an artist, as a makeup artist, and as a hairstylist, during chemo. I really learned like so much and had to figure out, different things to help. And so it's something that I like. I mean, that's part of my, I guess, kind of why God put me through this, is so I can help others even in that way. You know what I mean? So, I always tell ladies, like, if you want to come in, oh, my daughter's coming in for a kiss. If anybody ever
Cameo
wants to reach
appearance.
out, yeah, exactly. If anybody ever wants to reach out to me and just for advice with skincare, anything like that while they're going through chemo, I'm my inbox is always open, and I'm here for you guys. So definitely, anything, any way that I can help like that, I'm
Yeah.
happy to.
And
So
just to say it again, it's Cairo Makeup, and that's CHIRO Makeup. And is it .com, .org, or do they just look for
yeah,
that on
so
Facebook?
well, you can go on Facebook. We also have an Instagram that's Cairo Makeup, and then Facebook is Cairo Makeup, and then also CairoWeddings.com is the website. But definitely can hit me up on Facebook, my website, whatever works best for you. So
That's very cool. Well,
yeah.
the thing that I love about having you on the show is getting an update on everything, where you are in your journey. But before we get to that, I want to make sure that we let people know how this all started and kind of take them through a bit of your time through breast cancer, triple negative breast cancer, because everybody's story is very unique and different. and I know like your treatment options, for example. So take us first through how you found that you had triple negative breast cancer.
Yeah, so you know, I actually found my cancer 1 year prior to when I was actually diagnosed. So, in 2014, I was sitting on the floor. I can remember it so vividly. Sitting on the floor in my daughter's room. She was 3 years old at the time, and I was folding clothes and putting it in her little dresser. And I had an itch, and I scratched my breast, my right breast. And when I did, right where that itch was, I felt something that felt like about the size of a pea. My mamaw had been a breast cancer survivor for over 50 years and had it when she was very young. And so I immediately called my doctor and said, I think I need to get this checked out. Went in, got it checked out. They told me, well, okay, we're going to send you for a mammogram. Did the whole thing, went to a mammogram. Um, yes. Oh, yeah. My daughter's reminding me of something. She wanted me to bring up. We had a dog too at the time, and he actually bit me right in the spot where it was. It was really weird. It was like he was telling me that I had breast cancer. It was very strange, but I don't know.
What
Dogs are really
what kind of
intuitive.
yeah, what kind of dog was it, and how bad was this bite?
So the bite wasn't bad. It was just kind of like a little, I was holding him, and I swear it was so weird. He kind of was like sniffing me. And I was like, why is this dog sniffing me? And he kind of like bit me right where the tumor was. And it wasn't like a hard bite. It was almost like I'm warning you about something. It was like that. And so when that happened, that's when I really was like, okay, I've got to call the doctor. So I had that itch, and then that happened like the very next day with the dog. And so then I called the doctor. And when I called the doctor, went in, they said, okay, we're going to send you for a mammogram. My doctor said, I really believe that it's just you have fibrocystic breast. I really don't think it's anything, but we're going to send you anyways. Sent me for a mammogram. The radiologist told me it's nothing. And I said, okay, but can we have it biopsied just to be safe? And they said, no, I mean, there's nothing to biopsy. So I still felt uneasy about it. I felt like something was wrong. I called my OBGYN the next day, spoke to the nurse. She said, well, there just really isn't anything to biopsy. And I said, can you please just ask the doctor if there's any? I mean, I kept pushing on it. I really wanted to have this biopsy done. And they just kept telling me no. And they told me no, 3 or 4 times. And so I eventually was like, okay, well, I guess they're right. I guess it's nothing. I'm just losing my mind. I'm just paranoid. So I went an entire year because she said, let's have another mammogram. You'll come back in 1 year from now, and we'll do another one just to be safe.
I'm gonna
Um,
interject something real fast because it's so interesting that they were just so adamantly opposed to it. I know
mhm.
whenever I was diagnosed with fibrocystic breasts, they did a biopsy the first time and made sure that that's what it was, and then I still had to go
Yeah,
back every 6 months for screening, and then they would aspirate
yeah.
and test them and stuff. So
It was
yeah,
very weird. I don't know why, and
I'm
I really tried to push for it. As you can imagine, that doctor is no longer my doctor, but at the time, I mean, I believed her. She had, helped, she had been my OBGYN since I was like 17, and had my daughter with her and all of that stuff. So I trusted her. And, I mean, they're human. They make mistakes, I mean, I cannot blame a doctor for totally, you know what I mean? But, I definitely don't see that doctor anymore. But anyways, fast forward to a year later, it continued to grow. I was in the gym with one of my best friends, and I had her feel it, and she was like, "Oh my gosh, it's huge." At this point, it felt about like the size of a golf ball. And it was weird because it was like yin and yanging, and that's what my oncologist called it. She was like, it was like yin and yanging. It was like I could sometimes feel it really prominently and sometimes not. And then it just kind of got to this point where it was just, it was like just very big. And I happened to be like kind of leaning over one day, and I just grabbed it almost like this, and I could literally pick it up and move it around in my hand. And I know that
that is
sounds
so
kind of it.
creepy. That's
Yeah,
so
it was
creepy and
so
scary.
yeah, so scary, so weird. And so when that happened that night, when I kind of leaned over and I could feel it that way, I said, okay, I'm calling him again. This had been exactly a year. Called them. It was the day before my 35th birthday, I guess. So I was 34 when I was diagnosed. Well, barely. We turned 35 the very next day, but it was the day before my 35th birthday. Went in. They said, I mean, you could just see it on their faces. As soon as they did the mammogram, I mean, the nurse, everybody, I mean, you could just see it on their faces. And I knew it was breast cancer. And I also felt like I was BRCA1 positive. I don't know why I felt that way, except for it just had been in my family, and I just kind of felt like I probably was. And so the doctor looked at me, he said, well, we're going to call you back in tomorrow and do a biopsy. And I was like, no, you're not. I was like, you're doing it today because you missed it last year at this time. And you're doing it today because tomorrow is my birthday. And I'm not coming in here tomorrow. And he said, okay,
Wow.
we'll do it right now. And he did it. And then, of course, they tagged it with a titanium clip, and that kind of sealed the deal for me. And I knew, okay, it's breast cancer when they did that. So, went through all of that. Got my PCP. He actually got me in the hands of an amazing surgeon in Dallas, and she put me in a clinical trial. And I just kind of, I mean, it was just such a godsend at the time because my husband, being in the hair and makeup industry, I didn't have insurance. We had insurance for our daughter, but my husband and I, we're like, oh, we're still young. We don't need insurance for this and that and whatever. And so we were kind of skipping it for ourselves, but, doing it for our daughter. And so we had no insurance. And then literally they handed me this clinical trial and they said, if you do this, Courtney, you have no idea how many women this is going to help. And when they told me that, I knew that this was my assignment and that
So
this is what I needed to do for other
this is
women,
this is the part of your story that's so unique and special, and I'm curious, do you recall like what made you qualify? Because I know a lot of times people don't qualify for the different clinical trials that are available. Do you recall what it was about
Yeah,
your situation?
there was like a lot of check marks. And it just so happened that I fit it perfectly. It was my age. You had to be under 40. You had to be triple negative. And you had to be BRCA1, I believe. And I was BRCA1. They tested me for BRCA. I got that. Was there something you wanted to tell me? Do you know what the soup is? I don't know. She's needing soup now.
Saren, girl, man, come on. Your interview will be another day.
Exactly. Like your interview is another day, child. And she was not even supposed to be here. I don't know why they're here right now, but that's hungry.
Well, she needs soup. That's why she's here. She needs the soup.
But,
okay.
do you have a question? Do you want to interject in what we're talking about or what? Okay.
Yeah, the dog thing was good. The soup, not so much, dude.
Yeah,
know your audience.
Exactly. And she was very involved in everything.
Yeah.
I mean, she was 4 years old and we were very open and honest with her about everything. She was very involved with everything. So
she's a great kid too.
She is. She's my wild child. But anyway, so what was I saying? I think I was talking about the clinical trial. Yeah. So there was like all these check marks, definitely, I think you had to be BRCA1. So they did the testing. The BRCA1 testing was done for free. And at that particular time, I know it was really, really hard for people to get the BRCA testing done like through insurance and stuff. I believe now it's gotten a lot better. But I was lucky because I didn't have to go through insurance. It was part of the trial and you had to be like BRCA1 positive. You had to be under 40. It had to be at a certain stage. It couldn't be like over or under, it was like it had to be exactly like in this one stage. And you couldn't have, surgery until after chemo and all that good stuff. So yeah, I mean, there was all these like checkpoints. And then of course, you're in the clinical trial for 10 years and there's all these things and rules that you can't, things that you can't do. So like, for instance, like no herbal medicating yourself. You can't medicate yourself with like vitamins or anything herbal, because that could you know get messed up with the trial, and then they would say like, well, maybe it was that cured it, or maybe what I mean, like they didn't know. So there was like a lot of do's and don'ts.
Have there been things come up, Courtney, throughout the pandemic where they're like, the vaccine or anything like that? Is that viewed as an issue, or
I
having
don't
gotten COVID or
know.
anything?
I don't know I haven't heard anything about that. I've personally been concerned about getting the vaccine as a breast cancer survivor and having triple negative and being BRCA1. Not so much of like, you know, hey, like I'm a cancer survivor. It's more because I'm BRCA1. Because when you're BRCA1 positive, you're more susceptible to your cells going wacky and, just cancer
Well,
forming in your body.
this is a great question that I'm going to jot down, and we'll ask Dr. O when she's on next and find out
Yes,
how, because we're definitely have on the list of questions from the guest here tonight to ask her about how she feels about the COVID vaccine for just triple negative breast
yeah,
cancer survivors, and then
I think I sent you the question, but I was like really late sending it. I
oh,
apologize.
okay, no problem.
But but my question specifically is like, yeah, I mean, like how are they handling people that are BRCA1 or BRCA2? I mean, because we don't know what the outcome of this is, years from now. So, how did, to me, it's like, okay, well, how do the doctors feel about that? Do they feel like it's, yes, you should still get it. You're a cancer survivor. You should still get it. I haven't gotten it, and I'm not planning on getting it because of that reason. I'm scared to put anything in my body that's weird. You know what I mean? I mean, and I think a lot of us feel that way after having triple negative or any type of breast cancer or any type of cancer
Well,
at all.
I hope
I mean,
yeah, I hope Dr. O will be able to answer those questions and give everybody watching some sense of, how they should feel about it for their own self, whether they're triple negative breast cancer survivor, just any kind of breast cancer, or if they had any of the mutations that are found when you do that. Because I think that's going to be
absolutely.
super important. I know, I finally decided to have the vaccination. Well, first of all, before I did it, I messaged my primary care and my oncologist, and I said, "Do you think I need to do this? What is your thought?" And they're like, "Please, yes, do it, do it." I'm like,
Mm-hmm.
"Okay, cool." So I went and did it, but my thought process through that was kind of like, I'm pretty sure that whatever vaccine they're going to give me can't be as dangerous as chemo. I mean,
Absolutely. Yeah.
we're talking
Yeah.
about a 5-second shot compared to 3 hours of infusions for 4 months, and I'm like, and
I
with stuff
know.
that
Yeah.
is poison. So and I read it a lot into it, but I'm no doctor. That's why I rely on my doctors that I trust to tell me the best thing for me. And to be honest with you,
Absolutely.
I'm kind of like you. Like I don't normally do the flu vaccine either, but I think I might even start doing that from now on. But fortunately, I can tell you that just from having the first shot, and I did the Pfizer one, that everything's been fine. I had
Oh, okay.
very little, like I had some headaches
I've
off and
heard
on that
that from
day,
the
but
Pfizer one that it's really good.
yeah.
That people have less side effects and stuff from it. I mean, before I did chemo, I was exactly the same way. I'm like the kind of girl that if I have a headache, I just power through it. I don't even like taking Tylenol, and stuff like that. So even, I mean, then you get thrown into having breast cancer, and it's like bam, 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 all these drugs, and it's crazy. It's crazy how close to death you actually get, and that they bring you almost to death to save your life. And I know you've experienced that, and all of us have experienced it that have gone through chemo. And it's just something that's really hard to describe and understand until you have been through it.
Yeah,
Because I
because
mean,
I mean it makes such crazy changes in your body, as far as like the main thing that most people hear about is, oh, you lose your hair or you get sick, like throw like nauseous and you
mhm.
get sick and stuff like that. But there's like a lot more things that happen: neuropathy, changes to your fingernails,
Oh
your
yeah,
skin peeling off, just you know nothing tastes good, all kinds of stuff. And to, like you said, to go through that, it's pretty scary for sure. No doubt
it's
about it.
definitely scary. And on the other side of things, people don't realize how it affects you for years to come. I mean, I'm 6 years out and I still have issues with fatigue. My feet still peel sometimes. Like I have to really keep my feet moisturized and stuff because I still have an issue with my feet peeling, which is like crazy to me that we're 6 years out. I have cramps in my toes and in my feet and in my calves, and I never had any of that until, chemo. So, I know these are side effects. Plus, I was in a clinical trial. Now, one of the drugs that I was on that was the study drug, it has been approved. And I'll tell you what, it's an amazing drug. It's called veliparib. It's a PARP inhibitor. And it is an incredible drug for triple negative or ovarian cancer. And also, my dad, who had unfortunately passed away at the end of this year, but he was actually given that drug because he was my BRCA gene comes from him. He had colon cancer, and it had metastasized to the liver, and because he was BRCA1, they were able to give him that PARP inhibitor. Isn't that amazing? I
That
mean,
is, that's so
it
incredible because it's like
it
the same kind of thing. It's all birthed from the same thing.
it is, yeah. And so it's incredible that, these trials, I think trials are just so important. And, me being in one myself and being able to be in something that has helped so many people now, including my dad. I mean, he was, unfortunately, like I said, he passed away, but it did help him and it did prolong his life. And for me, it saved my life. So, and I'm very, very thankful to that. And I'm thankful to the doctors who God has given them the brain and the knowledge and the skills to be able to come up with these things for all of us, and it really
Yeah.
is amazing.
No doubt, man. For those of you just joining, we're talking to Courtney Phillips Long here today, triple negative breast cancer survivor, clinical trial survivor.
Yeah.
Yeah, COVID survivor,
COVID survivor. Well,
We're all COVID
actually,
survivors.
I have not gotten COVID, thank God, knock
Same
on
here.
wood, all
Yeah.
that stuff. But man, I mean, obviously being a cancer survivor, I think we're all, a lot more cautious, and we're not afraid to wear a mask. I mean, we were wearing a mask when it wasn't cool to wear a
Exactly.
mask.
Yeah, exactly. I was too, man. It's so true. So true. I want to give a shout out
So,
to Brittany Rose, who's in the house, who's also a triple negative breast cancer survivor out of Virginia. Thank you for being here, guys. Also, just some quick reminders while we're here chatting with Courtney that we are trying to get to 50 shares because we have a donor who said we hit 50 shares, they will donate $500. So be sure and share this out.
it's
Also,
awesome.
you can see on the screen a lot of times breastcancergetsticket.org/TNBC, and you can donate throughout the broadcast. Any amount helps. My gosh, my mouth gets ahead of my brain so much. But yeah, you can be sure and check that out. So okay, I want to know something else about this whole clinical trial. Like, how often do you have to check in? Do you have to go see a physician at a certain frequency, or do
Yeah.
they just send you updates that you need to fill out? Or
No, I mean, you definitely do. However, I have graduated to my 1 year mark now, which is amazing. And they're even willing to do virtual now that COVID is in play. But when it first started, it was, every 3 months, and then it graduated to every 6 months, and then it graduated to, once a year now. So now I go once a year. But this has been my first year that I've gone once a year, and I actually haven't been in because of COVID.
oh wow, yeah.
And they sent me to a lab just right down the street from my house, and I actually had my blood work done at the lab, and it sent it to my oncologist, and so that way we could do virtual visits. And so, I mean, I don't want to risk going up to the oncology office for any, I don't want to personally go in there and because I don't know if I have COVID or not, right? So, it's like if we've been exposed, we don't always know. So for me, I told my doctor I was more than happy to do virtual because you don't want to risk other people that are going in and having chemo and stuff like that. So,
Yeah, that's
you
really
know,
good. That's really good. I want to mention that Kristen Gross has said that your story is absolutely inspirational, and she's
oh,
wanting
thank
to
you.
know what stage both of us were when we were diagnosed. And Kristen, I was diagnosed in 2010, so I'm 10 years cancer free as of November last year, and I was stage 1, grade 3. And Courtney, how about you?
I was stage 2B, grade 3. I don't know what the B is.
Well,
I think it's,
yeah.
I can't remember what that was, but I just know it was stage 2B. I think that means that it's like almost to stage 3, but not quite, or something, if that
Right.
makes sense.
And, a great resource for those details is the American Cancer Society website. I totally suggest you go there. It's cancer.gov, I believe. And go and check that out, or make sure you just Google American Cancer Society and check that out. But they have like a huge PDF you can download that describes every different stage and all the B's. And there's even stuff like stage 2B, Roman numeral 2, or something like that. Like there's all
Yeah,
these subsets. They all mean something different. But I think for you, did you have any tumors in your lymph nodes, or did you have more than one tumor?
I had one tumor that was very large, but I was, it, again, just by the grace of God, it was kind of on the inside. So we have lymph nodes that obviously run like this, and then they go down. We have a lot that go down into the underarm. So a lot of times people will have that lymph node affected, like in the underarms and stuff like that. But luckily for me, even because my tumor was so large, if it had even been over, like, I don't know, like a half an inch, I definitely would have had a lot of lymph node involvement. But luckily, because it was in so far, even though it was so large, it didn't touch any lymph nodes. And so that was a complete and total blessing. And so when I did have chemo, the great thing about triple negative breast cancer, if you can say that there's anything great about triple negative cancer, is triple negative responds extremely well to chemo. So that's why now I don't remember. Did you have surgery first and then chemo?
Yeah,
Because you
so
were,
one of the things that they use to determine if you're going to have surgery first or chemo first is based on the size. And so, as I understand it, the smaller it is, the more likely you are to have the surgery first, and the larger it is, the more likely you are to have surgery second. So, I had surgery first, and then
yeah.
I had the 4 months of chemo following that. But I think you were the other way around, weren't you?
Yeah, we did the other way around, and it's because triple negative does respond really well to chemo. And if they can shrink it and get it gone before you go to surgery, and then you have a mastectomy, I mean, you have a less likelihood of having those rogue cells somewhere else, which is great when they go in to have surgery. And so, that was part of my clinical trial too, was to do it that way. And I know that now they're doing a lot of triple negative breast cancer survivors that way. They're doing chemo first and then surgery. And I don't know about the size thing now. I mean, because let's see, it was 10 years ago, and things change so fast. And I mean, even me, like I'm 6 years ago, and so many things have changed so much now. But I try to stay up on it as much as I can. But I will say this, when I first, I stayed up on it probably more when I first was diagnosed, in the first year or two after. And I want to give, all you ladies hope out there, because I know how hard it is when you're first diagnosed and you feel like I'm never going to wake up in the morning and not think about this. I'm never going to wake up and say, I had cancer and I'm afraid. And I'm afraid every single day. But I want y'all to know that I don't feel that way anymore. I wake up and I'm happy to be alive, and I can do things, and I don't think about cancer all day, every day anymore. And I'm 6 years out, and the good Lord has saved me. And I'm happy to be here and be alive and be able to share my story with other people so they can have hope too. Because that was one thing I thought I would never get through. It's like being afraid. And I'm at that point now where I'm not anymore, because I know that there's people out there like April and other people that are fighting for us all the time. And so you do get to that point where you're not afraid anymore and you can live your life again. And I want to give everybody hope to know that you can do that.
Girl. Yeah, I mean, you're super brave, super strong. I mean, to go through triple negative breast cancer is super scary, guys. It's a rare and aggressive form, more likely to recur. And so it's a very, very scary diagnosis to get. And then also to be so brave to go through a clinical trial, because you never know with those kind of things exactly what that's going to be like. And you're so blessed that that was an option for you because, as you said, you didn't have insurance, so that gave you a way where you were able to have treatment without having to pay for it. I assume they covered the whole thing. Is that right?
Yeah, they did. All of my chemo was covered. One thing that wasn't covered, which was crazy to me, was the Neulasta shots. And so, like,
Oh
when
my
you're going
gosh,
through,
those are expensive, dude. Those are
I
so
know.
expensive. How did you pay? How many cars did you
Well,
sell to pay for those?
yeah,
My
exactly. I think they're
God.
like $14,000 a shot or something.
Yeah. Well,
But
back when I had them,
luckily,
they were 8,000 a shot 10 years ago.
yeah.
8,000.
I think
Dang.
I'm probably over exaggerating, but I remember somewhere around like 10,000, maybe it was 8,000 a shot. But yeah, I mean, they were crazy expensive. And, that's another thing, that gets added on that you don't even know about until you're in chemo doing it. And they're like, oh, by the way, you're going to need this shot and we're just going to
Yeah.
stick
Oh,
it on
by
your
the way.
body.
Uh huh.
You're going to, we're going to stick it
Right.
on your body
Uh huh.
and then we're going to send you home and it's going to go off
Yeah,
in
that's
like,
so crazy. Yeah, because I think we've talked about this before. Because back in my day, since I'm old school, apparently, talking to everybody, had mine so much longer ago. I had to go up like a day or two after my
yeah.
treatment and have the shot in my stomach. And
Oh,
nowadays they send you home with like a patch that has a timer on it, and it
yes.
automatically injects you at that certain time, which
It's
is
like, hey,
nuts.
we're going to send you home with this little bomb looking thing on your body and then
Yeah, you're
it's
cool.
going
It's
to
all
go
good.
off.
Yeah, don't worry. Everything's gonna be fine.
Yeah.
Oh my
It's
gosh.
so freaky. And then
Yeah.
it causes tremendous bone pain. Those
Like
shots.
the worst ever.
Yes.
Like, I mean, that's what I talk to people about. My worst part of going through breast cancer, it was definitely the effects of that shot. Because I tell people it felt like I got beat with a bat,
Yeah,
like
it
over
was
my whole body.
so awful.
Yeah.
And they tell you to take Claritin to help with the bone pain. And I don't know if you did that or not. But I took Claritin for the bone pain and it
They,
did help. I mean, it did help a
which
little
is
bit,
so
but
weird.
I know it's very strange.
Because,
But it did help a little bit.
yeah, back when I had it, they had me take like just a ton of Advil, like a prescribed amount. Like they told me, my doctor said take this amount. It wasn't like I just was like, oh, I'm throwing them in. They had me taking a ton of Advil for that pain, and then later I heard a lot of people say that they had them take Claritin, which is so weird. There's got to be some connection because that's an antihistamine, so I don't really
Mm-hmm.
understand where the connection is, but obviously they found one and it does the trick. But
Yeah.
how did you cover those shots if they weren't covered by if you didn't have
So my
insurance?
husband luckily was able to get insurance for his company that he was working at the time. However, at that particular time, we were spending, it cost us $1,800 a month for the insurance. So it was crazy expensive. And I felt like we were making two house payments.
Yeah,
It was
it
like,
practically, yeah, that like totally is, man. That's crazy.
yeah.
That's a
So
lot.
it was, I mean, it was like $1,800 a month for our insurance, but it did cover, most of it. I think there might have been like a little bit, that it didn't, that had to go towards deductible. But I mean, I think when you have cancer, you hit your deductible like that. So, I think with that, and then of course, I believe my surgery was covered as well. The first surgery that I had, my mastectomy, I believe that was covered through the trial as well. I'd have to go back and look at my paperwork, but and chemo brain here, but I'm
Right.
I'm I'm almost positive. I know there was like biopsies, like I had to have another biopsy after I'd had the one. So they did the biopsy to diagnose me, but then my surgeon, when I was doing the clinical trial, you had to do another biopsy. And she actually went in and did a surgical biopsy where the first one was just like with a needle. And then the second one, she actually went in and did a little incision and stitched me up and did a biopsy that way as well. So took even more of it. And I don't know why they did that, except for it had something to do with the clinical trial. And then I believe like maybe it was like you have a sentinel node biopsy. You have all these different crazy things, bone scans, all that kind of stuff. I believe was included in my trial. And then it may have been the mastectomy or something like that that was included in the trial as well. But then, of course, I've had tons of plastic surgery
Right.
after that wasn't. I mean, it's because it's breast cancer, it can go through insurance, but it wasn't like necessarily covered all the way.
Gotcha. Yeah, yeah. That's crazy.
So yeah.
Dang, girl, that's a
Yep.
lot. So,
Well, we've been through it, girl. You've been
I
through it.
know.
We.
I know it's nuts, man. But it's good that you were able to get things covered. So now, do you have insurance still, and maybe a lesser expensive insurance,
Oh
or are
yeah,
you like never? Are
yeah.
you like never again will I live without
Yeah,
insurance?
never again, but we live without insurance. That's for sure. I mean, my husband got a government job after that, and our insurance has been great.
Oh,
So,
that's so good. I'm so
yeah.
glad. Wow, that's so good. Did you ever
Yeah.
meet other women that were going through the trial as well? Like, was there special
Yeah,
seating for you at the
I
infusion room?
did. So, crazy thing is there was only 100 ladies that were able to be in that clinical trial, and I was like, I think one of the last. I was in like maybe like the top last 10 that were accepted into the trial because it was about to get shut off right before I was in it. So, I met one other girl, and it was not face to face. I think I was pretty much the only one at Texas Oncology in Dallas that was in that trial. But I did. Oh, another kiss. Thank you. I
The
did
sneak
meet a young
cameo
lady.
again.
Yeah, I did meet a young lady who was around the same age as me, and she was in Houston doing the clinical trial. And we have followed each other over the years, on Facebook. And I've never met her face to face, but we used to talk a lot. Had a lot of the same symptoms, all that kind of stuff. And she is doing fantastic. She hasn't had a reoccurrence either. So, I mean, I'd say that, it was very successful for both of us. So,
That's really good. And so you
yeah.
said it was through Texas Oncology in Dallas was the
Yes.
yeah.
Yes. And the way it was I believe the clinical trial, I know they were following an MD Anderson trial kind of protocol and all that good stuff whenever I was going through it. And the drug, if anybody wants to know, at that particular time, it was called veliparib. I believe now it's called oliparib or something like that. But it is a PARP inhibitor, and PARP is a protein that everybody has in their body, um, but cancer loves it. So, and triple negative loves it. So, it inhibits that PARP so that the cancer cells can die. So at least that's how I understand it. I'm not a doctor, but that's how I understand it.
And we're
So,
so thankful for those doctors that do understand it when we don't.
absolutely, absolutely. So, and I'm sure Dr. O can probably tell you so much more about that, but
Yeah.
I'm sure she knows all about that.
Yeah, I made a note of what you said it does, just to kind of ask her a little bit about it, because that's pretty neat. And I don't know how much it's in use now, like if it's commonly used, and like under what conditions do they use it?
Yeah.
Like, do they just use it if you're over a certain stage, or what?
Hmm.
I don't know what it might be, but that's interesting to learn about. So whenever we talked a little bit earlier about when you went through your chemo treatment. Um, Tell us some more of the different kinds of like symptoms, or side effects rather, that you had from your treatment. Was it different much from what everybody else has for
You
side
know,
effects?
I don't know. I mean, I think that, obviously I lost my hair. That was a huge side effect. And I lost it pretty quickly into treatments. I think it was like the third week in and it was all gone. Um, I had to have a blood transfusion because I became extremely anemic. I had neutropenia fevers at the very end, which was interesting because part of the clinical trial was, I did Taxol. Oh gosh, I'm not even going to remember all the drugs. Taxol, carboplatin, and then veliparib, which was the study drug, and then let's see, and then it was the Red Devil. So that was like at the end. So I did a total of 20 weeks of chemo. So, and the one of the study drugs was an oral drug. So I took that like twice a day orally, and then I would go in once a week and have infusions of carboplatin and Taxol. And I mean, when you go in, you have your little cocktail, you have your Benadryl and your this and your that, and some people do Ativan and all these other things to make you basically like not feel anything, as far as the nausea and all that kind of stuff goes. But you still do somewhat have nausea. So my side effects were, I think they were pretty true to what everybody else was dealing with. But for me, the Taxol, carboplatin, all that, the carboplatin really did a number on me with my hemoglobin. So having, I just had so much weakness and stuff. But then when I did the Red Devil, I had been just slammed with so much chemo. And then I think I took like 2 weeks off, and then it was Red Devil. And when they hit me with that Red Devil, I mean, I was just done for. It was just the last straw. I mean, it was the straw that broke the camel's back. I was just wiped out.
Yeah, the Red Devil, the adriamycin is what you're talking about there.
Yes.
That one was the worst one for me too. I've heard some people say that their Taxol was worse, but to me,
no, that
Red
was
Devil
like a
was
walk
worse.
in the
Yeah,
park compared to the Red Devil. And
yeah.
when I got that drug, they had to dose reduce it. And this was part of the trial too. So the trial was like, okay, well, if they can't handle this, it was a certain amount that they gave you. So they, slammed me with it. And then it was like, okay, well, that's too much for us. So now we got to dose reduce it. So they dose reduced it. And then I went in. I think with Red Devil, you don't go in every week. It's like every other week or something like that. And you're supposed to have 4 of them. So I went in and they dose reduced. And then the second one was worse. I mean, and then that's when I got the neutropenia fevers, and I was just really bad sick. And they said, okay, no more, you're done. We can't give you any more per the trial, because we can't dose reduce anymore. So I actually ended chemo with only doing 2 rounds of the Red Devil, which I should have had 4. And I'm going to tell you what, I was glad that it was over, but at the same time, I was like scared, because it was like, give me everything that you got. I don't want to ever have to go through this ever again,
Yeah,
And
that's a lot like what happened to Lisa, the previous guest, is that they had to cut her off early, and she was like, "No, I want everything. I want all of it," because
yeah,
you
and you really feel
do.
that way because you've
Yeah,
been through it so much. And then when something like that comes up, you're like, what? No, we're not stopping. I'm in this for the long haul, and we're going to get this stuff gone. And so you want to fight, and you're in that fight mode, the whole time. But I will tell you, I was in the shower the day that they called me and said, we're not going to do it anymore. They called me. I was supposed to be coming in for chemo, and they said, we cannot dose reduce it anymore. And I was in the shower, and the water's like running on me, and I'm crying, and it's like I just heard Jesus telling me, it's finished. It is done. You are saved. And then I just felt total peace about it. And there were so many moments like that, where I had just these healing experiences, with the Holy Spirit that are just, incredible. And I can't explain it. I saw Lisa's picture as I was logging
isn't that
in,
amazing?
and saw
Yeah.
her story, and I'm like, man, that, I mean, I think we've all experienced some things like that. And just there's no denying God when you're faced with what we've been faced with going through cancer and being saved from it, and being able to just kind of, being able to kind of taste heaven on earth, even though we've gone through hell on earth with the chemo and everything like that, we've also tasted a little bit of heaven. And I think that that's really incredible, and I wouldn't change it for the world. And I'm glad that I was able to experience it, because of that, so.
Yeah, I totally feel you. It's crazy the positive takeaways that we've all had from having gone through triple negative breast cancer, and even many ladies that I've talked through that go through any kind of cancer. Um, they've all come out with something positive they could take away from it. It's definitely a learning experience. Definitely gives you perspective, strengthens your faith, strengthens your relationships with your friends and your family. I mean, there's a lot to be taken away from that. Well, girl, I just realized we're at the end of our time, and
All right.
it's been the 6th year for you and I to do this, and
Oh my
so
gosh.
cool. I told you yesterday, I was like, we need to like go through and make some kind of like little like compilation video of all of your interviews from all the years and show the transition
Yeah.
of you and your life in that amount of time, because it's really been incredible, and I'm so glad that you were able to join again this year, and I hope you'll be back again for our 9th annual in 2022.
I can't wait. And I'm just happy to be alive, and I'm happy you're here, April.
I'm happy to be here too, girl.
We're still kicking it. We're
Heck
kicking
yeah.
it. We're sticking it to them, right?
Yeah, we're sticking it to triple negative breast cancer day after day, man, all
That's
the time.
right.
Cool. Well, go hug that girl for me, and give her some soup. Let her know that we'll schedule some time with her so she can have her own interview one day and talk about what it was like being 4 years old and doing that.
Exactly. And she's like almost a pro skater now. So
See, I know, man. She's a rock star, skateboarder, and everything. She's rocking out there. So, Courtney, girl, thank you so much for joining. Be sure to stick around for Dr. O coming up next. And I've got your questions written down here. We'll be sure to go over them with her. And we will see you next year at the Triple Negative Breast Cancer Podcast 2022. I love you too, girl. Take care, okay?
Bye.
See ya. Guys, that was Courtney. She rocks, man. She's amazing. So cool to have her again. 6th year in a row for Courtney Phillips Long to be on the Triple Negative Breast Cancer Podcast.